Do you know someone who snores? Or do you know someone who tells you that even after sleeping for 8 to 10 hours at night, they still feel tired in the morning when they wake up? Or are you someone who experiences these symptoms? Well, this is not something which is normal. This could be the sign of an underlying sleep disorder. Sleep, such an important thing in our life. We sleep for one third of our time. That means if someone lives to be 90 years, they spend 30 years in just sleeping. But many are not so fortunate. Many don't get a good night's rest. Today, we are going to talk about one particular sleep disorder, which is obstructive sleep apnea. Today, I have on my podcast Dr. Sohil Gala, who is a ear, nose, throat specialist and surgeon. He practices in Mumbai. I had the opportunity to interview him at his clinic in South Mumbai, and we touched upon this topic of obstructive sleep apnea, snoring, and what it means. I am excited to put forward our discussion on this particular topic. Hello, everyone. This is Dr. Khushboo Gadda of FitFully Years, and this is my podcast, Brain on the Move. On this podcast, we discuss about how our physical health and mental health is related to our brain, and what we do in our daily life impacts our brain health, and how our brain health in turn impacts what we do in our daily life. So, this podcast is about touching upon different topics which exactly describe our brain health and how we can do small things to take care of it. If you like the content which we have shared on this episode, then do like, share, and subscribe to this YouTube channel, Fitfully Yours. You can also follow and rate the podcast on Spotify, which is the audio version of this particular podcast. So let's begin with this episode.
Okay, so now one thing is sleep apnea is something which is quite prevalent, quite common, but people aren't really aware about it. Like something as simple as snoring. I'm sure all of us have somebody or the other in the house who's snoring, but we feel it's okay, it's just some sound in the night, and most of us get used to it. But one thing which we may not realize is that snoring may actually be a symptom of something more serious, which is your sleep apnea. And not that every snorer will have sleep apnea, but almost 30 to 40% of people who snore may have some level of sleep apnea, and they are never diagnosed or never treated. And if not diagnosed or treated, it can have a lot of disastrous complications and sequelae like stroke, heart issues, blood pressure, diabetes, obesity. Everything is linked to it. So people are not yet very aware about it. I don't know if you all remember Bappi Laharida, the singer. So he also recently died because of complications of sleep apnea. So probably after that, people are slowly getting aware of it. So and since sleep apnea is a problem which deals with your upper airway, starting from your nose to your throat. So who other than an ENT who can manage patients with sleep apnea comprehensively and assess them? So there was this unmet need that we need physicians and ENT surgeons and the whole team basically, where you can address these patients with sleep apnea particularly. So which is why then I slowly started drifting into this subspecialty in ENT, where we are dealing a lot with patients with snoring and sleep apnea. So this is how we started. And of course, as residents, when we were training, this was something very new for us. I was training, say, 8, 9 years back from now. So this was still upcoming. So we used to be fascinated with the domain, with the surgeries, with the non-surgical treatments, and the whole concept. So slowly got more exposure, and then that's how I got more interested in getting into this field of snoring and obstructive sleep apnea, of course, which is a small subset in my ENT practice. Yes.
So sleep is something which I also, always ask my patients before anything. Ki, are you sleeping well at night? Are you able to, get a good sleep? Are you feeling fresh in the morning? Because that links a lot with the physical health, and how my patients also respond to my therapy will inflict on the sleep also.
Yes.
उनका फिर नींद कैसे क्वालिटी इज इट इम्प्रूविंग और नॉट. But sleep apnea is something I think which all of us, even if we are not an ENT specialist, even in the medical field, we should all be aware ki do we have do we have patients who have sleep apnea? How do we recognize कि okay sleep apnea है उनको and we need to refer them to a specialist for that reason. So first of all I just want to know कि आपका definition क्या है sleep apnea का कि क्या होता है exactly sleep apnea.
ओके, सो स्टार्टिंग विथ समथिंग वेरी बेसिक. सो आप नॉर्मली सांस कैसे लेते हैं इन द डे एंड इन द नाइट? इज आप नाक से सांस लेना शुरू करते हैं. The breath goes from the nose into your throat and then it goes into your windpipe and down in the lungs. So ये हमारा normal breathing pathway है, from the nose to the back of the nose to the throat to your windpipe in the neck and finally the chest. So this breathing pathway, because of any reason, if it gets obstructed, especially in the night, is when you get sleep apnea. So in simple terms, obstructive sleep apnea is, first word is obstructive, which means कोई चीज वो breathing passage को obstruct कर रही है. Sleep apnea means it's happening at the time of sleep, and apnea, the medical term apnea, means stop और cessation of breathing. मतलब उस टाइम के लिए आपकी breathing या तो कम हो जाती है या तो रुक जाती है. So in simple words, obstructive sleep apnea is when सोने के समय आपकी जो ब्रीदिंग है वो रुक जाती है फॉर वॉट एवर रीजन. सो जो आपका ब्रीदिंग पैसेज है उसमें या तो कोई फिक्स्ड ऑब्स्ट्रक्शंस मतलब स्ट्रक्चरल प्रॉब्लम्स हो सकती है, या तो डायनामिक प्रॉब्लम्स हो सकती है कि रात के टाइम पे जो थ्रोट के मसल्स हैं, मुंह के अंदर के मसल्स हैं, नाक के पीछे के मसल्स हैं, वो सब रिलैक्स होके पूरी जो ब्रीदिंग पैसेज है उसको ब्लॉक कर देते हैं, जिसके वजह से ये प्रॉब्लम होती है. So this is the very, very, very basic understanding of what this sleep apnea problem is. Yes. If this block is complete, तो आपकी पूरी ब्रीदिंग फॉर अ फ्रैक्शन ऑफ सेकेंड रुक जाती है. फिर इमिजिएटली आपके ब्रेन को सिग्नल जाता है कि आपकी ब्रीदिंग बराबर नहीं हो रही है, एंड द ब्रेन सेंड्स अ सिग्नल टू द बॉडी. यू वेक अप बट द पेशेंट डज नॉट रियलाइज. आपको समझ में नहीं आता कि आप उठ रहे हैं, ये सबकॉन्शियसली होता है. एंड ये साइकिल बार बार इन द नाइट होती रहती है, एंड बिकॉज ऑफ विच आप डीप स्लीप ले नहीं पाते. आप सोने जा रहे हैं, आपको नींद आती है, यू आर इन शैलो स्लीप, जैसे जिसको लाइट स्लीप कहते हैं. फिर जैसे आप गहरी नींद में जाते हैं, ये स्लीप एपनिया के एपिसोड आते हैं और आप जाग जाते हैं. सो बार बार आप ये साइकिल से गुजर रहे हैं, इसलिए जो डीप स्लीप का जो ड्यूरेशन होना चाहिए आपकी नींद में वो कंप्लीट नहीं होता, और जिसके वजह से आपकी वो स्लीप भले 8 घंटा 9 घंटा 10 घंटा हो, पर वो अच्छी सेटिस्फाइंग और डीप स्लीप नहीं हो सकती, जिसके वजह से आगे जाके बाकी सारे प्रॉब्लम्स होते हैं. एट द सेम टाइम अभी ये अगर कंप्लीटली ऑब्स्ट्रक्टेड है तो आपका ब्रीदिंग बंद हो जाता है, पर जब भी वो पार्शियली ऑब्स्ट्रक्ट होता है, ये भी काफी बार होता है रात में, तो पार्शियली ऑब्स्ट्रक्टेड जो आपकी ब्रीदिंग पैसेज है, जब आप उससे ब्रीथ करते हैं तो स्नोरिंग का साउंड निकलता है. कॉमन एग्जाम्पल, आपने सपोज आपके घर की जो विंडोज है वो पूरी ओपन रखी है और बहुत स्ट्रॉन्ग विंड्स ब्लो हो रहे हैं, तो आवाज नहीं आएंगी. बट अगर विंडो इज ओपन ओनली फॉर अ स्लिट और उसमें से अगर स्ट्रॉन्ग विंड्स पास हो रही है तो काफी सारी आवाज आती है. सो द सेम थिंग इज देयर इन स्नोरिंग, बिकॉज योर विंड पैसेज, योर ब्रीदिंग पैसेज इज पार्शियली ऑब्स्ट्रक्टेड. तो वो जब वहां से आप ब्रीथ कर रहे हैं तो अंदर की जो सब सॉफ्ट टिश्यूज हैं वो वाइब्रेट होती है, और फिर ऐसा आवाज आपके सोने के टाइम पे आता है. सो पार्शियल ऑब्स्ट्रक्शन गिव्स यू स्नोरिंग एंड फुल ऑब्स्ट्रक्शन गिव्स यू एपनिया. सो इन अ पेशेंट विद स्लीप एपनिया ये पूरी साइकिल्स कभी कभी पार्शियली ऑब्स्ट्रक्ट होगी, कभी कभी फुल्ली ऑब्स्ट्रक्ट होंगी, ये बार बार रात में होती रहती है. So this is what gives rise to all the problems in the night as well as the day. Yeah.
And sleep apnea as such is only obstructive, or is there any central cause also to it?
Yeah, so sleep apnea can be obstructive, can be central. So central cause is something which has to do with the brain. So as ENTs or with other treatment options, we can't really address or take care of central apneas, but obstructive sleep apnea, where the cause is block in the airway, is something which we can address and we can rectify. Central sleep apnea in majority cases we may not be able to rectify or correct. Now getting that obstruction out of it, sleep apnea is where you are stopping to breathe. So obstructive was what we already discussed, is when it's getting obstructed. But in central sleep apnea, your brain, which is supposed to send signals for the body to keep your air passage open to breathe, वो सिग्नल्स मिसडायरेक्ट हो जाते हैं, सही से नहीं आ रहे हैं, जिसके वजह से आपको ये सेंट्रल स्लीप एपनिया होता है। तो उसमें वॉलंटरी कंट्रोल तो ऑफ कोर्स बिल्कुल नहीं होता है, एंड द मैकेनिज्म फॉर बोथ सेंट्रल एज वेल एज ऑब्स्ट्रक्टिव इज कम्प्लीटली डिफरेंट। सो हम जब स्लीप स्टडीज करते हैं इन पेशेंट्स में, सो इट्स वेरी इंपॉर्टेंट टू अंडरस्टैंड कि कितना परसेंट एपनिया इज सेंट्रल एंड कितना परसेंट इज ऑब्स्ट्रक्टिव। बट यूजुअली इन पेशेंट्स ऑफ स्लीप एपनिया, majority of them have a predominantly obstructive component. Central sleep apnea per se थोड़ी rare problem है, and that is something which most of us dealing with sleep apnea don't regularly encounter and treat. So central sleep apnea is then later mainly dealt by either a neurologist or maybe a respiratory specialist. As ENTs, we are more in the domain of snoring and obstructive sleep apnea. Yeah.
एंड जो स्लीप एपनिया है वो किस पॉपुलेशन में ज्यादा रिस्क फैक्टर जैसे बोल सकते हैं कि ओके दिस पॉपुलेशन इज मोर एट रिस्क टू गेट स्लीप एपनिया इन द फ्यूचर एंड व्हाट थिंग्स आर देयर व्हिच कॉज स्लीप एपनिया?
Okay. So obstructive sleep apnea, I'm again specifying obstructive because in every case central sleep apnea की population या age group सब कुछ शायद अलग हो. So in obstructive sleep apnea, if you go to see, almost 60 to 70% of the patients of obstructive sleep apnea would be obese males. Like a large proportion of them would be obese patients, जिसमें भी males में ज़्यादा common होता है females से. But having said that, इट्स नॉट दैट स्लीप एपनिया सिर्फ ओबीज या ओवरवेट लोगों में होता है या सिर्फ मेल्स में होता है. स्लीप एपनिया कैन हैपन टू एनीबडी. ऑब्स्ट्रक्टिव स्लीप एपनिया कैन हैपन टू एनीबडी, right from a just born child to somebody who's in their 90s. So I'll give you a common example. Now, say you have a fit person who's in his 20s, but he has very, very large tonsils in the throat. उसकी जो नाक की सेंटर की बोन होती है वो काफी बेंट है, जिसकी वजह से उसके ब्रीदिंग में ऑब्स्ट्रक्शन आ रहा है. इस पेशेंट को भी स्लीप एपनिया हो सकता है. सो क्लासिकली लोगों को लगता है कि आई एम नॉट ओवरवेट, आई एम नॉट ओबीस, तो मुझे ये स्लीप एपनिया क्यों होना चाहिए. सो जैसे मैंने पहले बताया था, फॉर वॉट एवर रीजन आपकी ब्रीदिंग पैसेज में अगर ब्लॉक आती है, सो व्हेन यू आर ओबीस द ब्लॉक इज यूजुअली मोर डायनामिक, बिकॉज आपकी जो ब्रीदिंग पैसेज है, जो ओबेसिटी में जो फैट डिपोजिशन होता है, वो रेस्ट ऑफ द बॉडी के साथ साथ आपकी ब्रीदिंग पैसेज में भी होता है. एंड बिकॉज यू आर ओबीस, आपके मसल्स भी काफी वीक होते हैं, उनकी टोन कम होती है. तो दिन में ठीक है, बिकॉज यू आर अवेक, वो मसल्स एक्टिव रहते हैं, उनकी टोन अच्छी रहती है, तो ब्रीदिंग पैसेज ब्लॉक नहीं हो सकती. पर रात के टाइम पे व्हेन योर मसल्स आल्सो नीड रेस्ट, ये टोन मसल्स की और कम हो जाती है और वो मसल्स भी पूरे कोलैप्स हो जाते हैं. सो ऑलरेडी बिकॉज ऑफ फैट अक्यूमुलेशन उनका ब्रीदिंग पैसेज नैरो है, उसके ऊपर मसल्स रिलैक्स हो रहे हैं, इसलिए उनमें ये डायनामिक कंपोनेंट ज्यादा होता है. बट इन children, in younger people or in fit people, usually the problem may be more of a static component जहाँ पे structural problems है. तो नाक में structural problems हो सकती है, जैसे नोज की बीच की जो हड्डी होती है वो बेंट है, नोज में कोई पॉलिप्स हैं, ट्यूमर्स हैं, मस्से हैं. छोटे बच्चों में नाक के पीछे टॉन्सिल्स होते हैं जिसे हम एडिनॉइड्स कहते हैं, उसके वजह से हो सकता है. गले में टॉन्सिल्स होते हैं, उसके वजह से हो सकता है. किसी की जबान की शेप एंड साइज बहुत बड़ी है, सो व्हेन दे स्लीप द टंग फॉल्स बैक इन द थ्रोट, उसके वजह से ये स्लीप एपनिया हो सकती है. देन समटाइम्स वी हैव दीज स्पेशल चिल्ड्रन, फॉर एग्जाम्पल बेबीज विद डाउन सिंड्रोम एंड जिनकी स्कल डिफॉर्मिटीज होती है, तो उनमें जो आपके फेस का और टंग का और अंदर के मसल्स का प्रोपोर्शन होता है वो मिसमैच होता है. तो दे मे हैव अ स्मॉलर लोअर जॉ, जिसके वजह से उसकी टंग अगर नॉर्मल साइज की है पर लोअर जॉ बड़ी छोटी साइज की है, तो टंग जॉ में फिट ना होके वो पीछे ब्रीदिंग पैसेज में चली जाती है. सो स्लीप एपनिया अगेन इज वेरी कॉमन इन दीज स्पेशल चिल्ड्रन हु हैव फेशियल अनोमलीज. सो अगर देखने जाए तो लाइक आई सेड, 60% of the patients may fit in that classical category of sleep apnea who are overweight and obese, but you still have almost 30 to 40% who may not fit in the age and obesity criteria, where then you have younger people, fit people, children, kids with syndromes, facial deformities. So all of these patients are at risk factors for sleep apnea. Apart from this, other non-physical risk factors हम देखने जाएं तो somebody who's having a very sedentary lifestyle, inactive lifestyle, which where there's no exercise. So again, their muscles are quite not toned well. Somebody who's regularly smoking and having alcohol, especially towards sleep time. अल्कोहल से क्या होता है, ओवरऑल योर बॉडी मसल्स रिलैक्स, वो लूज पड़ जाते हैं. तो अगर आप हैवी ड्रिंकर हैं, जो स्पेशली पोस्ट डिनर या विथ डिनर ड्रिंक्स लेते हैं, तो रात रात के टाइम पे बिकॉज ऑफ दैट अल्कोहल इनटेक आपकी मसल्स और लूज हो जाती हैं एंड वो आपके एयरवे में कोलैप्स हो जाती हैं. एट द सेम टाइम जो रेगुलरली स्मोक कर रहे हैं, स्मोकिंग रिलेटेड मसल प्रॉब्लम्स होती हैं. एट द सेम टाइम स्मोकिंग ओवर अ लॉन्ग टाइम causes a lot of swelling in your breathing passage because your smoking is entering your lungs through the same breathing passage. So वो swelling के वजह से even smokers are at a risk for sleep apnea. And naturally we all may notice that when we are very tired, some of our family members say कि आप आज बहुत थक के आए हैं, जब सोए थे तो आपका snoring ज़्यादा था. So the simple reason is when you are very tired, your muscles are already overworked, you are tired, so the muscles need more rest. So when the muscles of the entire body, along with the throat, they need more rest. So in the night, these loose muscles again collapse in your breathing pipe, and that is when you get more snoring and chances of sleep apnea in the night. But this is again very transient to do with activity and your tiredness levels. But the other factors which I discussed about are more long-term problems. Yes. Yeah.
So, is there any particular number कि इतनी बार तुम अगर उठते हो रात में then you are having sleep apnea?
Yes. So, how do we now, coming back to the basic question, how do we diagnose sleep apnea? So, there is something which is called as a sleep study. In this sleep study, आपको रात को आपके घर पे या तो in the hospital, some few monitors are attached, but they are very light monitors. इससे usually आपकी sleep disturb नहीं होती, which picks up ये breathing आपकी कितनी बार रुक रही है. So, if the breathing is stopping for less than 5 times in 1 hour, so either stopping or reducing less than 5 times in 1 hour, then that is normal. अगर ये 5 times से 15 times तक अगर 1 घंटे में रुक रही है या कम हो रही है, वी कॉल इट माइल्ड स्लीप एपनिया. 15 to 30 times अगर वो हर घंटे में रुक रही है तो वी कॉल इट मॉडरेट. एंड अगर वो 30 times से ज्यादा एवरी आवर में रुक रही है, देन दिस इज सिवियर स्लीप एपनिया. So this is how we quantify sleep apnea depending on the number of events per hour. The events can either be full obstruction or partial obstruction. Yes.
So this particular number that you get, is it like directly correlated with the severity of the disease also कि उतना ही severe होगा disease है?
So not necessarily, क्योंकि जैसे मैंने बताया ये जो एपिसोड्स हैं इसमें दोनों चीजें आ जाती है, विच इज कंप्लीट ब्लॉक एज वेल एज पार्शियल ब्लॉक. एपनिया एज वेल एज हाइपोपनिया. एपनिया मतलब फुल्ली ब्लॉक हो गया, हाइपोपनिया मतलब ब्रीदिंग कम हुआ है उस पॉइंट पे. सो यू मे हैव समबडी जिसका ये वैल्यू सपोज 15 है, पर वो 15 के 15 एपनिया के एपिसोड्स है, वर्सेस यू हैव समबडी जिसका वैल्यू 50 है, पर वो 50 में सिर्फ 5 एपनिया के एपिसोड्स हैं, बट वो बाकी के 45 सिर्फ कम ब्रीदिंग के एपिसोड्स हैं. सो इट डज नॉट डायरेक्टली लिंक टू द सिवियरिटी. ऑफ कोर्स एक रफ आइडिया आ जाता है दैट समबडी विद 50 is of course more severely affected compared to somebody with 5 or 10, but there are a lot of variables which we have to consider. Another very important variable is your oxygen levels. So अगर आपका AHI level suppose 15 है, पर आपकी रात की ऑक्सीजन लेवल्स 80s में रह रही है, तो आपको ज्यादा प्रॉब्लम होगा. पर अगर आपका AHI वैल्यू, ये जो सिवियरिटी वैल्यू है, नंबर है, वो अगर 60 या 70 हुआ पर आपका ऑक्सीजन 90s में रह रहा है, then you are at a lesser risk compared to somebody who is in the oxygen level 80. सो हम जब पेशेंट्स को ट्रीट करते हैं, हम सिर्फ ये नंबर नहीं देखते, हम साथ ही साथ ऑक्सीजन लेवल्स कितना है, ये नंबर में कंप्लीट ब्लॉक्स कितने हैं, पार्शियल ब्लॉक्स कितने हैं, ये सारी चीजें, एंड अलोंग विद दैट पेशेंट की क्लिनिकल सिम्टम्स क्या हैं, ये सारी चीजें साथ में देखते हैं. उसी के बाद ट्रीटमेंट प्लान करते हैं और उसी के साथ हम पेशेंट को एक रफ आइडिया दे सकते हैं एज टू हाउ सिवियर योर प्रॉब्लम इज. सो एक नंबर से कंप्लीट सिवियरिटी पता नहीं चल सकती.
this obstructive sleep apnea, how does it affect the brain in any way? So when someone is waking up in the middle of the night and again going back to sleep, how is it affecting the brain and what changes can happen in the brain because of this?
Correct. So this is in fact a very long discussion, but we'll try and cover it in short. So first thing, coming back to the physiology, जैसे मैंने कहा था कि for your brain to function properly, sleep is very very important. So in sleep apnea, आपकी जो sleep है वो fragmented है, क्योंकि आप सो रहे हो, जाग रहे हो, सबकॉन्शियसली सो रहे हो, जाग रहे हो. सो नॉर्मली जो आपकी स्लीप होती है उसमें दो टाइप की पैटर्न्स होती हैं. एक जिसे कहते हैं REM, which is rapid eye movement, and then which is second one which is non REM, which is non rapid eye movement. तो ये जो non REM sleep है is more of a deeper sleep and more of a relaxing sleep. तो इन स्लीप एपनिया पेशेंट्स ये नॉन आरईएम स्लीप काफी कम हो जाती है, बिकॉज आप वो डेप्थ तक पहुंच ही नहीं पाते हो डीप स्लीप में. आप वहां तक पहुंचने जाते हो और बिकॉज ऑफ दिस ऑब्स्ट्रक्शन आप उठ जाते हो. तो बार बार आपकी जो आरईएम स्लीप का प्रोपोर्शन है वो बढ़ जाता है, जो लाइट स्लीप है उसका प्रोपोर्शन बढ़ जाता है, डीप स्लीप कम हो जाती है. सो बिकॉज ऑफ दिस डिस्टर्ब्ड स्लीप आर्किटेक्चर, आपकी स्लीप इज नॉट अ गुड फ्रेश स्लीप. So first thing which affects your brain is poor sleep. So just because your sleep is poor, your brain does not get that necessary rest in the night, and which is why in the day you are never fresh. So first thing, when these patients wake up, they have a slight headache. दे फील कि आई एम नॉट फ्रेश, मेरी नींद पूरी नहीं हुई है, मैं 10 घंटा सोया तो भी मुझे फ्रेश नहीं लग रहा है, ऐसा क्यों हो रहा है? बिकॉज योर ब्रेन, योर माइंड हैज नॉट गॉटन दैट रेस्ट. So first thing, it does not give your brain enough rest, which it is supposed to give you in the night. Now, if you have to see overall long term, sleep apnea can affect two aspects of your mind or the brain. One is a cognitive aspect, and one is an emotional aspect. So coming first to the cognitive aspect, तो sleep apnea के वजह से, because of lack of rest to the mind, lack of peaceful sleep, you will have cognitive problems like poor attention span in the day. You will be irritable, you will have memory issues in the long run, you will have a lot of anxiety. In kids especially who have sleep apnea, they are found कि उनको स्कूल में attention देने में problem होती है. A lot of kids who are diagnosed with attention deficit syndrome, काफी सारों में sleep apnea is the cause. So cognitive, then decision making आपकी थोड़ी impair होती है. Your reaction time is slower. आप किसी चीज को जो रिएक्ट करते हैं या आपके जो रिस्पॉन्सेज होते हैं वो थोड़े डिलेड हो जाते हैं. सो दिस इज द कॉग्निटिव प्रॉब्लम विद स्लीप एपनिया. नाउ कमिंग टू द इमोशनल प्रॉब्लम. बिकॉज ऑफ द कॉग्निटिव प्रॉब्लम्स, नेचुरली देयर आर इमोशनल प्रॉब्लम्स. यू आर एंग्री बिकॉज आपकी स्लीप पूरी नहीं हुई है. यू आर एजिटेटेड, इरिटेबल, सो यू आर एंग्री ऑल द टाइम. You don't feel like being a part of your regular activities, your entertainment activities, because you are like कि I'm always tired. मैं हमेशा थका हुआ हूँ, मुझे हमेशा नींद जैसा लग रहा है. सो आप में वो जो एक्साइटमेंट लेवल होता है, जो हैप्पी लेवल रहते हैं, वो काफ़ी कम रहते हैं. A lot of studies have shown that sleep apnea is indirectly also linked to more chances of depression, more chances of anxiety. So that's one. अपार्ट फ्रॉम दिस स्लीप एपनिया के जो फिजिकल इफेक्ट्स हैं, लाइक इट अफेक्ट्स योर हार्ट, इट अफेक्ट्स योर लंग्स, इट अफेक्ट्स योर किडनीज, इट अफेक्ट्स योर सेक्सुअल फंक्शन. तो जब स्लीप एपनिया की वजह से ये सब फिजिकल प्रॉब्लम्स हो रही हैं, तो बिकॉज ऑफ दीज फिजिकल प्रॉब्लम्स नेचुरली ऑल्सो योर इमोशनल एज वेल एज योर कॉग्निशन लेवल आर अफेक्टेड. तो डायरेक्टली भी स्लीप एपनिया की वजह से अफेक्ट हो रही हैं, एज वेल एज इनडायरेक्टली because of the other physical problems of sleep apnea. A person is having poor sexual performance, is affecting his emotions. Person is having uncontrolled blood pressure, diabetes, that is again taking a toll on his mental health because he's affected because of that. So all of these things are very intimately linked. And yes, good sleep, like we all know, is very important for a powerful and good mind. So the main problem is your sleep is incomplete, so everything gets affected. So this was just in a nutshell ki how does your mind as well as brain, so cognition as well as emotional function is affected in sleep apnea. Apart from this, जो neurotransmitters होते हैं, your brain has a lot of these chemicals which are helping in your brain to function. Some of them are exciting chemicals which keep your brain alert and active, and some of them are inhibitory chemicals which keep your brain dull. सो ये स्लीप एपनिया के पेशेंट्स हैं उसमें ये एक्साइटेटरी केमिकल्स थोड़े कम पाए जाते हैं, एंड जो इनहिबिटरी केमिकल्स हैं वो थोड़े ज़्यादा होते हैं, विच इज़ वाई यू आर नेवर वेरी अलर्ट एंड एक्टिव एंड यू आर ऑलवेज इन दैट डल स्टेट कि आपको कभी भी बैठे बैठे नींद आ जाएगी एंड आपको किसी भी चीज़ में इंटरेस्ट नहीं आ रहा है. सो ये सब चीज़ें बहुत कॉमनली पाई जाती है, एंड अनफॉर्चुनेटली एज फिजिशियंस एज सर्जन्स वी probably neglect or don't pay too much attention to these aspects, and we only look at numbers which we discussed, which was your AHI. But taking the whole thing in the picture, it's not just the numbers, it is how this sleep apnea is also affecting you mentally, physically, as well as emotionally. So we have to take everything into consideration. Yeah. The quality of life of definitely is very bad. Yes, very yes, bad. Yes. And one thing that you said about the heart related issue also which comes with sleep apnea. So how is that linked? That how does obstructive sleep apnea affect your heart and your overall cardiovascular health? ओके या सो फर्स्ट थिंग बिकॉज आप रात को ये जो ब्रीदिंग एपिसोड्स होते हैं जहाँ पे वो हार्ट आपकी ब्रीदिंग पैसेज ब्लॉक हो जा रही है, योर बॉडी हैज टू पुट इन मोर एफर्ट्स टू ब्रीद, and more efforts to breathe are basically at the level of the chest where your heart and lungs sit. So more pressure in the chest indirectly puts pressure on the heart, so the heart has to pump more blood in the night for those muscles to act. Now just like the rest of the body, even the heart normally is supposed to take a step down and rest. अगर normally आप दिन में आपका pulse rate देखते हैं तो 70 to 90 के बीच होना चाहिए, but the sleeping pulse rate is normally supposed to be between 40 to 60 because the heart also is taking slight rest. But in sleep apnea, because of this excessive pumping of blood into the muscles which are needed for breathing, रात को भी हार्ट को वो रेस्ट नहीं मिल पाता. रात की भी हार्ट रेट 70 80 90 इनफैक्ट ज़्यादा भी हो सकती है. सो दैट्स वन थिंग. आपकी हार्ट रेट, हार्ट ज़्यादा पंप कर रही है, हार्ट रेट अफेक्ट हो रही है, हार्ट को रेस्ट नहीं मिल रहा है. बिकॉज ऑफ इंक्रीज प्रेशर इन द चेस्ट, वो डायरेक्ट प्रेशर हार्ट को ट्रांसमिट हो रहा है. एंड द मोस्ट इंपॉर्टेंट थिंग इज एवरी ऑर्गन इन द बॉडी, जो लंग्स है, हार्ट है, दे ऑल्सो नीड ऑक्सीजन. सो वेन एवर योर रेस्पिरेटरी पैसेज या ब्रीदिंग पैसेज ब्लॉक हो रही है, दैट पर्टिकुलर सेकेंड को आपके पूरी बॉडी को ऑक्सीजन कम मिल रहा है, विच ऑल्सो इंक्लूड्स योर हार्ट एंड लंग. तो थोड़ा माइनर डैमेज उसके वजह से एवरी डे होते रहता है. So in the longer run, you can have common problems like heart-related blood pressure, heart attacks at younger age, cardiac arrhythmias. Your heart has to work and pump stronger. तो हार्ट की जो वॉल्स होती हैं, मसल्स होती हैं, वो सूज जाती हैं, तो वी कॉल इट एज हाइपरट्रोफी ऑफ योर हार्ट चेम्बर्स. सो ये सारी प्रॉब्लम्स हार्ट में हो सकती है. Even your lungs, because of your overwork, also start getting affected. So sleep apnea has a significant cardiorespiratory insult on a long term basis, which also needs to be addressed. So which is why again sleep apnea becomes a very important treatment disorder which needs to be evaluated, because it is affecting almost each and every body part. So we had already discussed about the brain and the mind. Now we discussed about the cardiorespiratory system. So these are two very important systems which are responsible for our day to day functioning. So if one very simple example, अगर आपने सोचा है कि काफी सारे जो natural deaths होते हैं in especially in older men और older women, obese patients, वो आपके अगर आप न्यूज़ में देखेंगे या आपके फैमिली मेंबर्स में, तो लॉट ऑफ द टाइम्स वी हियर कि वो मॉर्निंग में उठे ही नहीं, रात को अपनी नींद में ही गुजर गए. सो इन दैट दिस स्लीप एपनिया इज अ वेरी मेजर फैक्टर. So sleep apnea in the night when it's severe, it can cause to some amount of heart damage. And when it reaches this threshold and the heart damage is large, is when you can have these sudden cardiac deaths in the night, which can be linked to sleep apnea. And one more thing, because the heart is also affected, there are more chances of a cerebrovascular stroke as well, right? So I have seen, because as a neurophysio, I do see a lot of post-stroke patients. So
many of them, I have seen a few young stroke patients also. So they are clueless कि क्या हुआ है, मतलब why is it happened to me, because no cholesterol issues, no blood pressure till then diagnosed. So they were very clueless कि क्यों मुझे stroke हुआ है. So could this sleep apnea be also a factor for them to get a stroke?
Yes, yes. So sleep apnea is a very important and a common risk factor for cerebrovascular accidents also. In the same mechanism, what I've explained is increased pressure to the heart and heart issues, which eventually give rise to these cerebrovascular accidents. You have more chances of thrombotic episodes, more chances of emboli. So definitely somebody with sleep apnea, if untreated and undiagnosed, is at a higher risk for stroke and other neurovascular problems compared to their peers of the same age who do not have sleep apnea. So we do see early age transient ischemic attacks या stroke in patients of sleep apnea. Normally अगर 70s या 80s में होना होता तो शायद 40s 50s में भी हो सकता है. So definitely linked to sleep apnea. Yes.
Linked to sleep apnea. And so, what are the signs of sleep apnea that someone should see in them? So, first of all, daytime sleepiness and all those things that you mentioned. But is
Yes.
there anything else that a person should notice within themselves कि okay मुझे ये issue भी हो रहा है, so maybe I should go and consult a specialist about this?
Correct. So now coming to your basic signs and symptoms of sleep apnea. So firstly, since it's sleep apnea, let's first start with the night symptoms. So in the night, patients mostly, most of these patients, not all, but most of these patients will have heavy snoring. Their partners, their bed partners, either their wife, husband, parents, children, whoever is in the same room, they in fact very classically sometimes tell us that we see the patient is snoring and suddenly the snoring stops with a choke, and then again after a few seconds the snoring starts. It's like, and they wake up with a sudden choke where the patient is not awake, but subconsciously they wake up and they again go back to sleep. So snoring and then sudden breaks in snoring, and then again the snoring starts. So this is one thing. The patient may get more frequency of urination in the night. If it's a child, they have episodes of bedwetting. The patient, when they now next coming to morning, so when you wake up, a lot of patients have headaches in the morning. A lot of patients don't feel fresh in the morning. They wish that kash मैं थोड़ा और सो लेता. Now coming to the rest of the day, so like we had already discussed in the brain problems, so your alertness level is less, your concentration is less, your memory problems start, you are very very sleepy in the day. So we commonly call it as EDS, excessive daytime sleepiness. तो ये जो पेशेंट्स होते हैं वो हमने देखे हैं कि ऐसे बात कर रहे हैं किसी से बैठे बैठे और उनको झपकी आ जाती है. अगर वो कार ड्राइव कर रहे हैं और एकदम हाईवे पे हैं ऑन अ empty road where they are steadily driving without a lot of brakes and झटकास, उनको ड्राइव करते करते भी नींद आ जाती है. एंड दिस इनफैक्ट हैज बीन a common cause for a lot of road traffic accidents. Then they can have problems in their sexual function. They are irritable, they are angry in the day. वो अगर बच्चे हैं तो वो स्कूल में बहुत अच्छे से कंसंट्रेट नहीं कर पाते. उनकी जो कंसंट्रेशन अटेंशन है वो एक जगह से दूसरी जगह पे पहुंचती रहती है. इसके अलावा जो मेडिकल प्रॉब्लम्स हैं, जैसे आपकी बीपी है, जो आपको फैमिली हिस्ट्री नहीं है पर आपको यंग एज पे बीपी का प्रॉब्लम आ गया है, आप बीपी के लिए मेडिसिन ले रहे हो बट वो बहुत इजीली कंट्रोल नहीं हो पा रही है, दिस इज अनदर पॉसिबल साइन ऑफ स्लीप एपनिया. अगर आपको डायबिटीज आ गई है यंग एज पे पर आपको और कोई रिस्क फैक्टर्स नहीं थे डायबिटीज के, जैसे कि फैमिली हिस्ट्री या ओबेसिटी, तो स्लीप एपनिया कुड बी वन ऑफ द रीजंस. A lot of weight gain could also be a problem because of sleep apnea. Of course there can be multiple reasons for everything, but अगर कोई unexplained hypertension, unexplained cardiac problems, unexplained diabetes, unexplained weight loss, where everything else in the testing is normal, it can be because of sleep apnea. So these are the possible signs that you need to be aware of कि ये सब हो रहा है तो मुझे sleep apnea होने के चांस हैं. The most common thing is excessive daytime sleepiness and lack of energy. Lethargy and just alas is something which majority of our patients come with. एंड देन जब हम पेशेंट्स को और डिटेल में पूछते हैं तो बाकी की चीज़ें भी पेशेंट्स बता पाते हैं ऑन इंक्वायरी. बट यूजली प्रेजेंटिंग सिम्टम्स आर यूजुअली द पार्टनर्स कमिंग विथ that the patient is snoring a lot, and डे टाइम में द पेशेंट कमिंग विथ कि मैं इतना फ्रेश नहीं रहता हूँ. सो दीज आर द कॉमन प्रेजेंटेशंस.
So daytime में इतना fresh नहीं रह पाता हो, yes, or any of the depression and other things that you said during the day. So do these people, I have seen that usually these people think that they should consult a psychiatrist or they should consult maybe someone else for this reason. So what is the one thing that they should consult an ENT particularly for this problem?
Correct. Yeah. So originally, the ENTs in sleep apnea were mainly coming in for the surgical treatment, where when nothing else is happening, medical treatment या जो भी non-surgical treatment fail हो गई है, that is when they used to send to us to an ENT for mainly surgeries of the nose, of the throat. But now recently the things are changing that all these patients should not just be seen by one physician, but what we are trying to do is have a team approach where we have one physician, we have one ENT, we have a mental health specialist like a psychiatrist or a psychologist, we have a physiotherapist and or a sleep language pathologist, we have a dentist, we have a dietitian, and we have a surgeon who is working at weight loss surgeries. So we are trying to work as a team. So every patient is addressed and assessed by all of us. Of course, there may be some patients which may not need all the specialties, but overall, if all these specialties are on board working together, then you can have a holistic and a complete management of all these patients, which is what is needed. Because अगर वो सिर्फ physician के पास जाएंगे, he is going to target mainly the BP and the numbers of the AHI, and इतना शायद जो उनके मेंटल हेल्थ या इमोशनल हेल्थ या जो भी ENT रिलेटेड इश्यूज हैं वो उतना टारगेट ना कर पाए. So everybody may be seeing the patient from their specialty point of view. So if you have a team which is dealing with sleep apnea, then usually the management is much more comprehensive, holistic, and something which definitely is recommended.
How common is it? How, like, if you say that in a number of 1 to 10, how many people out of 10 people would be having sleep apnea?
So if you have to see now, there aren't too many statistics available for Indian population, but if you see world population, 3% of 3 to 5% of patients, 3 to 5% of the population may have sleep apnea. So 3 to 5% is 3 to 5 out of every 100. So that's an average number. But of course, you can have milder forms of sleep apnea, which may bring the proportion to higher. But the sleep apnea, which needs medical care and attention, on an average, maybe say up to 5%. So 5 in 100. So which is also a big number. Yeah.
So, what would be the treatment for sleep apnea?
So before starting with the treatment, the foremost important thing is the diagnosis. So which we have already partly discussed. जिसमें वो sleep study हुआ, we got that number. Along with that, we try and see what all are the systems affected, and depending on that, we chalk out a treatment plan. But like I just said, a holistic treatment is what is needed. So now I'll in short tell you the role of each and every specialist. So coming to a physician will help you in managing the comorbidities and the sequelae of sleep apnea. So firstly, your diabetes, heart, stroke, उन सब का जो management है will be done by a chest physician or a intensivist or a MD physician. As ENTs, we are there in ruling out very easily correctable causes कि अगर किसी को टॉन्सिल्स हैं, नोज की बोन्स बेंट हैं, अंदर कोई ट्यूमर्स हैं, अंदर स्वेलिंग है, तो दैट वी कैन इजीली एड्रेस मेडिकली और सर्जिकली. एट द सेम टाइम देर इज नोबडी एल्स अपार्ट फ्रॉम एन ENT हु कैन एक्चुअली सी what is happening in the sleep. So हम क्या करते हैं, just to artificially understand what's happening each night, हम पेशेंट को थोड़ा सा नींद का दवाई देते हैं. एक बार वो सो जाते हैं, with help of the injection medicine of the sleep, we put a small camera from the nose to the throat, and we actually see कि ये कौन सी लेवल पे हो रहा है, ये नाक में हो रहा है, गले में हो रहा है. ये देखने के बाद अगर हमको लगता है कि ये चीज़ बहुत इजीली अगर मेडिकली सर्जिकली ट्रीट हो सकती है, देन हम वो पेशेंट्स को ऑफर करेंगे, बट हमको लगता है नहीं, ये मेनली काफ़ी सारी लेवल्स पे प्रॉब्लम है, पूरा एरिया जो है वो नैरो हो रहा है, एंड वी शुड नॉट अटेम्प्ट अ सर्जरी, देन वी सेंड देम फॉर समथिंग विच इज कॉल्ड एज अ सीपैप। सीपैप में क्या होता है, रात को पेशेंट सोते वक्त एक मशीन और मास्क लगाते हैं जो कंटिन्यूसली एयर आपके थ्रोट में पुश कर रहा है, नाक से एंड मुंह से, जिससे ये कोलैप्स नहीं होता। सो इन अ लार्ज मेजॉरिटी ऑफ द ओबीस पेशेंट्स, सीपैप इज द मेन ट्रीटमेंट. Now, these were the main modalities which we concentrate on. But moreover, we always tend to forget our colleagues who are physiotherapists, speech language pathologists, even dentists, dietitians. All of them play a very, very important role. So, since you are a physiotherapist and since we've been closely working together for a lot of our patients of sleep apnea, just in brief, if I have to tell, a physiotherapist can help in a lot of ways. So first is the obesity. So that's the most important factor. So agar aap, with the help of exercise and physiotherapy, if you can slowly tackle the obesity, you are significantly helping the patient. Even a 10% reduction in the BMI, जो वेट और हाइट का जो कैलकुलेशन होता है जिसे हम बीएमआई कहते हैं, तो अगर उसका अगर 10% रिडक्शन भी होता है, it reduces your sleep apnea by almost 25 to 30%. So that's the first most important thing. So one thing, rather than the BMI also, what is more important is the body composition. Yes. So the abdominal fat is the most important thing. So even if your BMI is like your weight is staying over there, but your abdominal fat is coming down, then that is a more positive sign that your sleep apnea will also be addressed. Agree. Yes, absolutely. Absolutely agree. So that's one thing, which is your weight, obesity, and your body fat distribution and your body shape, like you already said. Now, second part is I said the sleep apnea problem was primarily arising from the nose to the throat. And the main issue which was happening in majority patients were the muscles which were relaxing a lot and collapsing into the breathing passage. So as a physiotherapist, they target these muscles of the breathing passage. So muscles of the tongue, muscles of the palate, muscles of the throat, muscles of the chest, the breathing muscles. So if you are targeting these muscles either with active physiotherapy techniques such as electrical stimulation, all these things also significantly change the course in a lot of our patients. And this is the second place where a physiotherapist or a speech language pathologist comes in the picture to strengthen and improve the toll of the muscles. Third thing is coming to something where when you are sitting, your fat, your fluid in the body, sitting or standing or in the daytime, is more in the lower part of the body. When you are sleeping, all this comes into the upper half of the body, in the chest, in the neck. So this increases your congestion and your edema in the upper part of the body, which further worsens your sleep apnea. So a physiotherapy with the help of active exercises and focusing on the lower body, your calf muscles and all, can also help us in this redistribution of fluid and fat and edema in the night time. So this is also where a physiotherapist comes in the picture. And of course, I'm an ENT, so I would not know the minor details at each level as to how you can help. But I would ask you to probably tell that anything else which you want to add, like how you can help our patients with sleep apnea for with physiotherapy. So first of all, targeting the obesity. Again, obesity is target along with diet and with exercise. So they recommend that in a week you should do at least 150 minutes of aerobic activity. Okay. So 150 minutes means 5 days, 30 minutes. ऐसे divide किया तो. Along with that, resistance training, strength training is again very important because people say I walk and that is the only exercise they do. But no, along with walking or doing cardiovascular activity like walking, jogging, cycling, along with that, you also need to target your strength training and improving the resistance of your muscles. Because what happens is when you improve the resistance and strength training, automatically
your muscles become more fatigue resistant.
Yes.
So fatigue resistant means that in case of sleep apnea again, because the muscles are becoming very tired and they're collapsing, because they become fatigue resistant, so their tone improves and automatically they become better in improving the collapse. And again, they have not done a lot of studies on the muscle inspiratory muscle training or the breathing exercises, because that is still studies are less. But breathing exercises again, how they would help is that they would improve the muscle strength, especially inspiratory muscle training. So, naak se lambi saas lena, or doing it with the help of spirometer. All these things will help in improving the chest expansion. So at night, when you do get an episode of apnea, कि suddenly आपका सांस रुक गया, so automatically your chest has to expand and the intrathoracic pressure has to increase.
Yeah.
So because you are doing these exercises, your muscles are better equipped to handle this increased intrathoracic pressure.
Pressure. I get that.
And along with that, the muscles of the oral oropharynx and
Oropharynx.
the tongue.
Yeah.
So last question is that have you seen any patient and successfully treated them for sleep apnea? So if you can describe the entire course, ki how that patient came to you and what all challenges you faced and how you dealt with everything.
Okay, so of course there are many patients who we are treating on regular basis, but here we'll start with, I'll discuss about one young patient of mine. So he was a 30-year-old male, not really obese or overweight. His He was like a 5'8" height guy with a weight of around 75 to 80 kg. So slightly high BMI, but not really very overweight or obese. But his wife basically used to complain that he has heavy snoring and he has those choking episodes in the night. And in the day, he said that whenever he's at his workplace, he's never fresh. He's always very tired and not very active. And in fact, his wife had said that she's actually noticed that he's had a few short episodes in which, when he's driving to Lonavala and things like that, he's actually dozed off for like a fraction of second, 2 seconds, and she's woken him up. And she came to me that, he's not fitting in that classical sleep apnea category, but why do you think this is happening? So then we discussed and we realized that, yeah, he is fitting into it. So we did two things for him. First was the sleep study. So that number which we initially discussed about, the number was something around 27 for him. So that is approximately a moderate category. His oxygen levels were staying between 85 to 90 for most of the night. So that is not very bad, but not absolutely normal also. And then, because he was a young and almost fit person, not really overweight, we wanted to see that what exactly is happening in the night, because I didn't want to put him directly on a CPAP, that putting a 30-year-old who's not obese on a CPAP for every night, he was not willing to accept that treatment option. So we put him under slight anesthesia, as in the sleeping injection, and we saw his breathing passage from the nose to the throat. So the surprising fact was he had problems at multiple levels. So in the nose, his bone was slightly bent and the passage was narrower. In the throat, he had tonsils, but these were the two fixed problems. But apart from this, his throat muscles were collapsing a lot. So we realized we are dealing with a complex problem here, where there is a structural problem as well as a dynamic problem. So for the structural problem, I had to operate him, where we got his tonsils out, we got his nose passage wider. But after that was done, his sleep apnea had not yet completely resolved, because we are still to address the dynamic factors. So for that, then later I I got him in touch with the speech language pathologist, the therapist who works with me. So she started on training for strengthening the oropharyngeal muscles, and he's currently doing it since the last 5 to 6 months by himself after he's been trained. And he has seen a significant change from what it was before starting the exercise and now after regularly doing it. Of course, there was already a significant change after the surgery itself. So probably, if you have to give a rough estimate, say 60 to 70% of the problem we had probably addressed with the surgery, but the remaining 40%, we are trying to deal with the help of physical therapy, muscle strengthening, and at the same time, he's also working on his weight training. So he's following a good diet. He's regularly going to the gym, exercising, cardio. So his overall fitness also is good. So this is how we are tackling this patient. So if you see, this patient does not have a one step or a one stop solution कि किसी को लाइक इफ यू से किसी को कैटरैक्ट है, आपने सर्जरी कर दिया और बात खत्म. सो स्लीप एपनिया का प्रॉब्लम यही है that the treatment may not, or in most of the cases is not one stop. You have to actually keep going on, and you have to involve a lot of specialties for a complete treatment. So this is one example of a young person. Apart from that, of course, we get a lot of 60s and 70-year-olds who are obese, who are 100 kg, who have sleep apnea. So in them, of course, the main thing is we start them on CPAP. But फिर जब अब उनका CPAP का treatment चल रहा है, side by side we educate them about other things which we can do. So the most important is weight loss. So either do it naturally with the help of our dietitian colleagues, nutritionists, or then go to a surgeon and get a weight loss surgery done. At the same time, some amount of physical training, like you already discussed, all the wonderful points, which will further slowly help them in building up their muscle strength and their fitness. So we are helping them at each step to reach the final goal. Yeah. So this was a good summary that you gave about the entire obstructive sleep apnea. And I also got to learn a lot ki how I can address this particular issue when I see patients with physical problems, but maybe having this underlying issue also, and I can refer them immediately to a specialist for that. Yes. So this was a very good talk that we had overall about obstructive sleep apnea, and thanks a lot for sharing this information with me, and I think the audience will also benefit a lot. Yeah, I definitely appreciate your efforts that you are bringing forward these talks regularly. And I just wish you all the best that keep coming up with such relevant and important topics. And so that even our general population is well aware of them and they know who to reach out to and how to go about, and are not really just relying on random unverified information from Google or internet. Or waiting till it becomes extremely severe. Yes, absolutely. Yes, yes. Thank you so much.